guys, so today I'm going to be talking about mycoplasma pneumonia. So pneumonia comes in many forms. There's viral pneumonia, aspiration pneumonia, ventilator-associated pneumonia, and the one I'm going to be talking about today is mycoplasma pneumonia. So it's also known as walking pneumonia or atypical pneumonia. So walking pneumonia is just because the symptoms are milder than regular pneumonia, so you actually feel like getting up, walking around, but you still feel really sick. It was discovered in 1944, and it was originally thought to be a fungus or a virus, but it's actually a bacteria. So it attacks the body by attaching itself to the epithelial cells at the base of the cilia, and it damages it. So this caused the body's immune system to kick in and produce those icky feelings that we usually feel when we get sick, like runny nose, headache, fatigue, sore throat, headaches, and persistent coughing. Skip the slide. So some risk factors are smoking, stress, chronic illness, and it mostly affects people that are between the ages of 5 and 15, but it also affects people of the geriatrics, so the advanced age, and people with a weakened immune system, and it can occur at any time of the year, but it's mostly diagnosed in the fall and the summer. So some facts about it: it's very contagious. The bacteria can thrive within your nose, throat, and lungs, so that means if a patient does have this, you need to exercise droplet precautions, because if they sneeze or cough, they can get those bacteria out in the open, and then if you also touch like a dirty tissue or something like that, then you can contract it as well. It does have an incubation period of 1 to 4 weeks, so that means you can actually give it to somebody without even showing symptoms first. It does occur in crowded areas like schools, hospitals, nursing homes, etc. The biggest thing with preventing this is washing your hands. And that's good with just about anything. Cold and flu season, you just need to practice good hygiene. So if you start feeling bad and you want to go to the doctor, your physician will order a round of lab work, like blood work, throat swabs, and chest x-rays. Goodness gracious. So now that you're sick, what do you do? So some cases never get detected. These are usually just the milder cases. Some people think they must have just like a cold or something like that. They're just going to get over pretty soon. And usually if that does happen, it just takes some time getting over. So if you do go to the doctor and it is detected, your doctor will prescribe a round of antibiotics. So that's really good. Early intervention is good to overcome this disease faster. So you will get over it without medication, just medication helps kick it out a lot faster. So prognosis is very good with this disease. It's resistant to some medications that have penicillin in them, so if your doctor prescribes you something with penicillin, it's not going to work. And recent studies have shown that some of the strains of mycoplasma pneumonia are becoming resistant to some antibiotics. Does anybody know why? If you guess the overprescription and overuse of azithromycin, you're correct. And now that I've read that and I think about it, every time I go to the doctor for a cold or anything like that, they always give me a steroid shot and a Z-Pack and send me on my way. So that makes a lot of sense to me now. So prevention of this disease is just good hygiene, washing your hands all the time. There's not a vaccine at this time, although there is a vaccine for pneumonia, but there's not one for mycoplasma pneumonia. So this disease is not like chickenpox. So chickenpox, you can get it, but then usually you won't get it ever again. But with mycoplasma pneumonia, you can get it multiple times in your lifetime. That's because it doesn't build immunity. So if a patient does have this, they'll be experiencing some functional limitations and impairments, like abnormal vital capacity, impaired gas exchange, dyspnea, abnormal breath sounds, difficulty navigating sloped environments like inclines, and they're not going to be able to walk long distances because of their limited respiratory issues going on right there, and their endurance is going to be really hindered. So in physical therapy, a patient can expect to receive patient education on postural drainage, respiratory techniques, some stretches and exercises to open up the chest and airways and reduce the kyphotic posture that some people get as they age. So it's just going to really open up the chest and allow them to breathe better. And also endurance training like gait training on uneven surfaces, going up hills, going down hills, around obstacles, just to build up their endurance. So a PTA or a PT needs to be aware of some contraindications and precautions for these patients. They do have some patients do have overlapping pathologies. So along with mycoplasma pneumonia, they could have diabetes, osteoarthritis, lupus, really anything. So you need to take the whole patient into consideration and not just one disease that they may have. These patients will need frequent rest breaks, and the patient needs to be taught to pace themselves. And sometimes a doctor will prescribe an inhaler if they're having a really hard time breathing. So during exercise and physical activity, they need to have that inhaler ready if they need it. So you need to tell the patient to bring it with them when they come. Some contraindications. So as a PT or PTA, we need to be able to take vital signs and assess the patient before and after, and sometimes during physical therapy. Some lab values that we need to take into consideration is white blood cell count, and if it's less than 1,000, there should be an exercise, or if they have fever, along with their white blood cell count being less than 5,000 or greater than 10,000, there should be no exercise. And if these patients are on antibiotics, their platelet count is going to be messed up. So if it's less than 20,000, there should be no exercise. And then oxygen saturation is a big thing because these patients are having limited respiration. So if their oxygen saturation is below 92%, there should be no exercise until a physician has cleared them for it. And these days, a lot of people have diabetes, so blood glucose is another thing to take into consideration. If it's below 100 or above 250, there should be no exercise. Thanks for listening, guys. And if you have any questions, you can comment below or send me an email. Thanks.